Dear students, welcome back. In the previous session we have discussed about motion of pelvis at the hip joint. Now in this session we are going to discuss about the coordinated motions of the femur, pelvis and the lumbar spine. Okay, when the pelvis moves on a relatively fixed femur, there are two possible outcomes to consider. Either the head and trunk will follow the motion of the pelvis, okay, or the head will continue to remain relatively upright and vertical in spite of the pelvic motions. So these are the two possible outcomes. So here what is happening in this pic? Here the femur is relatively fixed. The first possible way, that one is head and trunk will follow the movements of pelvis here, or the head will continue to remain relatively in upright position. So like this in this pic, so relatively upright position in spite of the pelvic motions. Whatever the pelvis is movements are taking place, but there is no movement in the upright position of the head and neck there. Okay, so these are the two types of possible outcomes to consider in the coordinated motions of femur and pelvis. Okay, normally these are open kinematic chain and closed kinematic chain responses. Okay, each of these situations produce very different reactions from the joints and segments proximal and distal to the hip joints and pelvis. These two should be examined separately. Okay, so now we will move on to the lumbar pelvic rhythm. Okay, so Caillet, who used the term lumbar pelvic rhythm to describe the open chain phenomenon in the hip joint, pelvis and lumbar spine, where coordinated activity of the segments produced a larger range of motion than might be available to one segment alone. So here the main purpose of this lumbar pelvic rhythm is to produce larger range of motion altogether. Okay, if you take one single segment, then the range of motion is small. If all together move, then the range of motion is increased. Okay, lumbar pelvic rhythm is clearly the analog of scapulohumeral rhythm. That means it is having a similarity of scapulohumeral rhythm, where the combination of motions at several joints serves to increase the range of available motion to the hand, isn't it? Yes or no? Yes. So for example, reaching the floor through isolated flexion at the hip joints, anteriorly tilting the pelvis on the femurs, is generally insufficient to reach the ground. So only flexion at the hip joint, okay, flexion of the hip joint, and also anterior tilting of the pelvis is not enough to reach the ground. That too, if the knees remain extended, the hips can only flex. If the knees are extended, the hips can only flex to 90 degrees only. The additional flexion of the lumbar spine will incline the trunk forward about another 45 degrees. Okay, the combination of hip flexion and lumbar flexion should be adequate to reach the floor. Okay, so during knee extension, So what is the range of hip flexion? Only 90 degrees. So this 90 degrees of hip flexion and this anterior tilting is not enough to reach the hands to the ground. It requires the flexion of lumbar spine, okay, which will incline the trunk forward about another 45 degrees. So this lumbar flexion is required to reach the ground. Okay, the combination of hip flexion and the lumbar flexion is required to reach the floor. Okay, now the lumbar pelvic rhythm can increase the range of motion available by adding range from the lumbar spine. So if you see, when a woman lying on the side lying, okay, then the lumbar pelvic rhythm can increase the range of motion available by adding range from the lumbar spine. So for example, we know that the abduction is about 45 degrees only. So here a woman is in a side lying. An attempt at maximal abduction of the top leg will bring the leg through as much as 90 degrees of motion. Okay. So how it happens means, we know that only the hip abduction is only 45 degrees, isn't it? How this remaining 45 degrees is happening means, so the hip abduction along with lateral tilting of the pelvis with that of the lumbar spine. So this causes the increase in range of motion. Okay, and also the side flexion of the lumbar is also taking place here, if you can observe here. Okay, so this pelvi-femoral motion increases the range through which the foot can be moved in space by combining left hip abduction and lateral pelvic tilt, that is called pelvi-femoral motion. And beyond that, so now we are studying the lumbar pelvic rhythm. So it has to increase further, means it requires the flexion of the lumbar spine. Up to here, this is called as pelvic hike, and then the remaining side flexion of the lumbar helps in further range of motion. Okay. So unlike scapulohumeral rhythm, lumbar pelvic rhythm in all directions occurs without a specific mandatory sequence of activity and without a fixed proportional contribution of its component parts. Okay, so this is the thing happening in the lumbar pelvic rhythm. So because if you see in this movement, so if you see only at the pelvi-femoral, the range is less. So when the addition of this lumbar flexion, which increases the range, the main motto of this lumbar pelvic rhythm is to increase larger range of motion by the movement, by the coordinated motions of the femur, pelvis and the lumbar spine. So this is all about the lumbar pelvic rhythm. Thank you.